All right.
Good morning. I'm Nancy Winslow, and I'm here at the Scotland Neck Auditorium on behalf of the Scotland Neck Business Association. Rural Health Group in Scotland Neck is going to do a COVID clinic today, and they are so organized and have it set up. So we're going to go inside. I want to show you the process from the beginning to the end. So follow me inside. When you come in the door, you come in the front door, you are asked to fill out some paperwork. So they want you to come about 15 minutes early to fill out your paperwork. And let's walk over here and I'll show you paperwork. So you'll have a form to fill out with some personal information. And then once you fill that form out, you'll be asked to go into the auditorium. And they're asking that you sit every other row. It's kind of mellow in here with the lights low, but you'll see that the nurses you'll sit at the end of the row, and the nurses are actually coming by and giving you the vaccine as you sit in the row. So we're just going to walk around the auditorium and show you how that's going. And after they've all been vaccinated, we'll hear from the Chief Operating Officer for Rural Health. Our very own Tracey Tucker is the practice manager at Rural Health Group Scotland Neck and Rich Square, and she is in charge of this clinic here today. So the nurses are filling the vials here. This is where all the supplies are kept. Good morning. So you can see that we've got a lot of people in here today. They're planning to vaccinate about 300 in the auditorium today. And these people will come back on March the 30th for their second vaccine. Just as easy and organized as you could possibly ask for. So let's walk up and down the aisle. If you have any questions, we can direct those to Tracey, because certainly I don't know the answers. Okay, they do want them. All right, so.
I'm sorry. It's RSV drug code, whatever's on the card.
So we can cut through here if you want to. We can go back down the other aisle. Are you ready? I'll tell you what would be good is for us to follow Tracey when she gives the vaccine. Wouldn't that be good if we followed her? Okay. All right, let's see. I think they've all been vaccinated on this side, so let's walk over there and let's go back over there.
Okay.
I think you can see that it's just as quiet in here and organized And all these people have been vaccinated. And in just a minute, we'll hear from Keisha Rooks, who's the Chief Operating Officer for all the rural health groups. And she's going to talk to them about the 15-minute wait time.
Thank you.
Do you have any questions, Blaine?
No questions so far.
Okay.
Several people watching.
Good. Thank you for
Good amount.
watching
Yeah,
this
thank
morning.
you.
Most everybody in here has been vaccinated. They have a large staff here this morning, and so things are running just as smoothly. When you have an 8:30 appointment or whatever appointment time you have, they keep it to 30 minutes. So you get here 15 minutes early. And these people got here at 8:15. They filled out their paperwork. They came in the auditorium and sat every other row. At 8:30, they started the vaccinations, and they had enough nurses. They had enough nurses to vaccinate all these people in about 10 minutes. And so in just a few minutes, you'll hear from Keisha, who's going to talk about the 15-minute wait time. Blaine, let's walk down front and see the
Okay.
supplies again for the people that are just signing on. This is another supply stand. Okay, this is Keisha coming right here, so we might want to take a minute to listen to her. Dahlia. Hey, Dahlia. How can we find out more about getting the vaccine? So there is a link, and I can post that on Facebook a little bit later today. They're not doing another clinic today, but they are going to be doing 3 more clinics this week, and I can tell you where they are, but they're going to be operating just like this one. So I'll post that link as soon as this clinic is over. Okay, I think this is, maybe Keisha's getting ready to talk.
Okay.
If you see another question, Blaine, just
Okay.
let me know.
Good job. Sonia, good job.
Oh, thank you. Thank you very much. So I think they are doing a great job for sure in here. I'm just glad that we're able to bring this video to you to show you how the process works. So it's nothing to be afraid of, and it is a almost liberating experience to know that you are working toward the end of this pandemic by getting your vaccine. How are
you
you?
doing?
Good. How are you? There are people here from counties outside of Halifax County because, as you know, the vaccine is a federal program and you can go anywhere and get the vaccine. Doesn't have to be in your county, so there are people here from other counties. The biggest thing that you can do for your friends is to make sure they know how to sign in.
Obviously, you can probably expect a sore arm and then get a vaccine. You can have tiredness, chills, blood fever. Typically, we're not seeing that in the first dose, but it can happen.
I hope we don't miss the bus.
They probably ask you about whether you've had a vaccine in the last 2 weeks, right? Okay. Don't go get any other vaccines probably until 2 weeks after your second dose. Because it's going to be kind of close. You can get it in 2 weeks from today, and 2 weeks till your next dose. So I would say just wait if you want any vaccines for the flu, shingles, pneumonia until 2 weeks after your second dose, okay? Does anybody have any questions? No, your second dose is 28 days. Don't go get another vaccine until 2 weeks after your second dose. Any other questions? We'll let you know when you can leave. But if you have any questions come on, just let us know, okay?
So there you have it. That's the vaccination process here at the Scotland Neck Auditorium, put on by the Rural Health Group here in Scotland Neck, and that's our primary care facility here. And it's an excellent organization, and I hope you'll check it out. So if you have any other questions, you can message me those questions. I'll be glad to transfer those to Tracey over at the Rural Health Group, and you're always welcome to message me. But thank you so much for looking today, watching the video. I think you'll see that it's a pretty painless process, and you're working toward the end of this pandemic. Thank you very much. Have a wonderful day.
Practice manager for Rural Health Group in Scotland Neck and Ridge Square, and I just want to thank everybody for coming out and taking this first step in slowing this virus. This is Keisha Rooks, my Chief Operating Officer for Rural Health Group, and she's just going to go over a few things about the vaccine and answer any questions that y'all may have.
Good morning, everybody, and first of all, congratulations for receiving your first Moderna vaccine. The vaccine that you just got, you should have received a Cdc Vaccination Card. If you have not received this card, please raise your hand and we will come around and bring you a card. This is your proof of vaccination. On this card, you should have your last name, first name, and your date of birth, and it will also say Moderna along with the lot number. You will need to bring this card back with you when you come back for your second dose, and I'll be talking about second doses in just a minute. Please do not laminate this card. We have to write on this card when you bring it back. We will document that second dose right under where we documented the first dose. On the back of the card, you will see a date. That date will be March 30th, 2021. This is not an appointment card. That date tells you that your second dose can be on or after that date. It cannot be before that date. So if you decide to go somewhere else for your second dose, that is absolutely fine. You will need to take this card with you so that you can be sure that they give you Moderna vaccine. Now that you have received the Moderna vaccine, You cannot switch to Pfizer or Johnson & Johnson. Your second dose must be Moderna vaccine. Anybody have questions about that? So the next thing I'm going to talk about, you should have received this education form. If you did not, we can also get you this form. Side effects that you can now expect. You can expect that you will have a sore arm. You may have some swelling in that arm. You may have some tenderness in that arm. It may be a little bit difficult to move. None of that is unusual. You can use an ice pack on that arm. We do ask that if you need to take Tylenol or ibuprofen, that you wait at least 4 hours after this injection before you take that. If you've taken that before you came, that's fine. It's not going to make the vaccine not work. We just ask that your next dose be at least 4 hours after this dose. Other side effects that you may experience, you may have a headache, you may have body aches, you may have some chills, you may have absolutely nothing at all. Those are just potential side effects. None of that is unusual. It can last 24 to 48 hours where you just don't feel good. If you have symptoms that become concerning to you, please do not call the Scotland Neck Town Hall. They will not be able to help you. You will need to contact your primary care provider. If Rural Health Group is your primary care provider, we will be glad to work with you through that. Otherwise, contact whoever you see for your regular doctor's care. Let's talk a little bit about immunity. This first dose gives you about 50% immunity. Your second dose will get you to about 95% immunity. That second dose is just as important as this first dose. Until everybody gets vaccinated and we reach what's called herd immunity, you will still need to wear your mask, social distance, wash your hands. And the reason that is because right now everybody is not vaccinated. So what this vaccine will do is you can still contract COVID, but if you get COVID, it will be a mild case. You wouldn't be hospitalized. You may not even know that you had it. But someone who's not vaccinated that you're around could get COVID from you and end up hospitalized on a ventilator, and worst case scenario, they could die from COVID. So you want to be sure that you do not stop doing what you're doing now. Wash your hands, wear your mask, social distance, and encourage others to be vaccinated. Do not get any other vaccines until 2 weeks after we have given you your second dose. They have not studied how vaccines mix together. So right down here at the bottom, you want to wait until mid-April if you are scheduled for a shingles vaccine, a flu vaccine, a pneumonia vaccine. Let's finish this series before you get any other vaccinations. Does anybody have any questions, comments, concerns, anything that we have not answered this morning? You have about 5 more minutes that we have to monitor you. After you're monitored, we're asking that you exit out of this door so that we don't have the congestion in the back. Again, congratulations, you're halfway there. Thank you.